Today I'm going to be making a presentation about healthcare in the United States, including southeastern Oklahoma. It's early morning. As a good example is my internet isn't the greatest at home, so this assignment is late. And this has been kind of a common thing until I get my internet set up. This is a common battle here in southeastern Oklahoma with everybody. Internet is an issue. So how I'm going to start this off this morning is healthcare. I'm a paramedic. I've been a paramedic for about 30 years. Been in flight EMS, worked all over southwestern United States and all over Oklahoma. Started this a long time ago, and we began healthcare. We provided healthcare in a complete different way back in the early 90s when I first got into this. My parents had been in healthcare for years prior to me getting into it. So back in the day, when I was a child, back in the 70s and 80s, you could get a physician. You could call the guy at midnight if your kid was sick. Nowadays, you've got to go through a corporate process. A doctor can't hang a shingle out or a sign in the middle of town and say, bring all your patients to me, because of rules and regulations have stifled them into a system where they've got to have a certain kind of computer system, certain type of billing software, all kinds of different things that keeps the regular small guy out that's not connected to corporate healthcare. Corporate healthcare is our problem. Corporate insurance, healthcare insurance, is our problem as well. We're going to have to scrap this whole system. We, as a small rural EMS service, we provide healthcare to 900 square feet with 4 trucks. That sometimes can be very taxing as far as for what we do. One of the major issues in this area is that we have one small rural hospital that is basically, they can handle small, low acuity things. They don't have cath lab, they don't have ortho, they don't have general surgery. So most of our patients, we're transporting an average of 30 and 40 miles to some hospitals that have a higher level of definitive care, but not the greatest. I work in south central Oklahoma, and our closest rural cath lab, 24-hour cath lab, is an hour and 20 minutes away. Trauma, you're going to be taking these patients straight to Oklahoma City. You're going to be utilizing flight EMS if the weather is great. If the weather's no good, you're transporting these patients an hour and a half to definitive care. It just depends on the level of trauma where they're at. So the corporate healthcare models have utterly changed the face of healthcare in the past 30 years. It's provided money to shareholders. Approximately 95% of the money taken into the system was doled out to shareholders in the system, not out to increase wages, not increased research like they say they do. These companies should be held accountable for what they do. They're literally untouchable with how they practice. Us as customers, I hate to use the term patient, but we're technically no more than a customer to these guys. And if we start giving them bad reviews on Press Ganey scores, if the hospital adheres to that, most of them do because of Medicare billing, they may change things, but the major problem is corporate healthcare. We need to redesign the system in the way of Healthcare should be delivered at the community level. We should be attracting high-end doctors over time. It's not going to happen overnight, but we need to attract high-end doctors, high-end healthcare. We need to depend on co-ops as far as people paying into a co-op instead of health insurance. That would help provide higher quality healthcare in your community. High quality EMS, police, fire, hospital services. Over time, when you build up money, you're going to be able to attract obstetrician, ortho doctors, surgical people. Trauma is kind of an odd thing. I mean, it's not really odd, but trauma really needs to go to a level 1 trauma center. I do agree with that, but there needs to be more availability of cath labs. We're starting to see cath labs disappear here in central Oklahoma out in the rural areas, or they're being cut down to, just 8 hours a day on-call basis. Some of them are just like, hey, we're here Monday through Friday and sorry about your luck. Orthopedics, that's a whole different story. Sometimes ortho is touch and go depending on the hospital. Again, OB, that's a complete different animal all in itself, because the problem with OB, the malpractice insurance is very expensive, and so attracting OB doctors is completely different. You got to have a system that's willing to pay their insurance to get them to come to you to work. But this whole system needs to be scrapped and started all over with. We need to start with insurance that is based in a co-op where everybody pays into it. This Obamacare stuff was a joke. It was a complete joke, complete failure. Everybody needs to pay into healthcare. That is true. But how they went about it was completely wrong. You can't have people not paying into it. Giving them free healthcare is socialist medicine, and that doesn't work. I mean, people may not agree with that, but that absolutely does not work either. You look at healthcare models in Canada, Europe, people are on a waiting list for 6, 8, 10, 12 months for just regular minor surgical interventions. We don't need that system here either. So, I mean, we need something that pays in just a little bit. Everybody pays in, and we don't need profit margins. We need this to go into the system, and it doesn't go out to shareholders. It's not corporate owned, and it's not based out of the stock market. Our healthcare is Walmart healthcare, if you really get technical. And we need to scrap it completely, start all over again, take out the profit, put the money back into people, research, and equipment. Quit building hospitals up, build them out.